Welcome to our module on surgery of the ovaries and uterus. Before we talk about surgery on the ovaries and uterus, we'll talk very briefly about some of the reproductive endocrinology in dogs and cats. And I mean briefly. I'm a surgeon. You don't want me teaching you about this. The stages are proestrus, estrus, diestrus, and anestrus. Most importantly, the difference between dogs and cats is that cats are induced ovulators, that the production of a corpus luteum requires induction. That lasts about 37 days in a non-pregnant cat. Dogs are spontaneous ovulators, and there is progesterone dominance for about 60 to 100 days when they're non-pregnant. Cats can also be seasonally polyestrous. How do you tell? Hormones as well as vaginal cytology. The only reason this is pertinent for surgeons is determining where in a cycle a dog and a cat may be in terms of its influence on pregnancy or Pyometra. Some basics of pregnancy in dogs. The length of pregnancy lasts about 57 to 72 days from the time of mating. If you're going based on cytology from the first day of diestrus, it's somewhere from 51 to 60 days. From the time of ovulation, from the LH and progesterone surge, it's 64 days. Again, that's just a little bit of background information, less important for us surgeons over here. On radiographs, you'll be able to see bones of the skeleton around day 42, and on ultrasound, pregnancy will be detected around day 18 to 20. You can also look for other signs of pregnancy on blood work, such as anemia, a leukocytosis, sometimes a cholesterol or protein elevation. How can you predict that parturition is close? Based on drops in progesterone and temperature. For pregnancy in cats, ovulation is stimulated by copulation, and gestation lasts about 56 to 69 days with an average of 66 days from mating. And on radiographs, bones are able to be seen around 25 to 29 days prior to birth. So those are just some markers of cat pregnancy. So parturition in dogs and cats can be different. Dogs have a shorter period of time and more defined stages. Stage 1 usually lasts less than 24 hours. Stage 2 and 3, less than 36 hours. So going from some of those changes in behavior to active straining should be relatively quick. In cats, about 86% of cats, parturition lasts less than 6 hours for all kittens, but there are some cats who can have an interrupted parturition and sometimes a delay of up to 48 hours between kittens. This is very important for diagnosis of dystocia. A conversation that you'll be having very frequently with your clients is, why should we spay or neuter? Why should we spay? Of course, population control, sometimes behavior, so aggression reduction, particularly with neutering, mammary gland neoplasia. The risk of mammary gland neoplasia increases for each estrus with dogs and cats. If the cat or dog is spayed prior to the first estrus, there is minimal, almost no risk of mammary gland cancer, so adenocarcinoma. Other disease processes that can be less frequent or decreased in severity by spay can be diabetes or epilepsy. Of course, the ones that we'll be encountering as surgeons include pyometra and uterine neoplasia. In studies of dog populations where none of them were spayed, there was an approximately 23 to 24% risk of pyometra by 10 years of age. So very, very common disease process. Whenever you're trying to have a conversation about why you should spay or neuter a pet, you also have to be informed on why maybe spaying or neutering could have some downsides. Obesity and decrease in their metabolic rate certainly can happen with spay or neuter. There are certain cancers, neoplasias, that are more common in spayed and neutered dogs. Some of these are breed specific. Incontinence, so urethral mechanism incontinence, is certainly of higher risk in spayed female dogs. You might hear this called spay incontinence for that reason. So certainly these are important conversations to have with owners, but in most cases, it does not put the balance towards not spaying or neutering your pet. Other questions you'll get from clients will be, what's the difference between an ovarioectomy alone or an ovariohysterectomy? Some of these clients may be coming from Europe, where the flank spay is very common and only an ovarioectomy is performed. And some of these clients may also be debating whether to have a laparoscopic assisted ovarioectomy performed, in which usually it is just the ovaries that are removed. There is no significant difference between ovarioectomy or ovariohysterectomy in terms of short-term recovery or long-term risks. There is no difference in risk of metritis or pyometra with ovarioectomy only, nor is there any difference in incontinence or weight gain. For ovarioectomy, there may be a slightly smaller incision and less tissue manipulation, but again, either OVE or OVH are both appropriate. In terms of a laparoscopic or a laparoscopic assisted ovarioectomy compared to an open spay, again, a lot of this is very much client specific. An open spay is absolutely appropriate for a large breed dog, but for a large breed dog, that may be very helpful to have an ovarioectomy performed laparoscopically, small incision, and you can also perform a prophylactic gastropexy at the same time through either the same or one smaller incision. Recovery time for a laparoscopic spay versus an open spay, in the first 48 hours, we do see in some studies that dogs are more active, suggesting that they may be in less discomfort. But in the long term, even within a few days, the recovery for both procedures is excellent and comparable. So whichever the owner prefers is likely appropriate for that pet. So what are some reasons based in the ovary while we may be going to surgery? Certainly, ovarian neoplasia, cancer, and ovarian cysts can be seen, but they're not incredibly common. Certainly, unfortunately, ovarian remnant syndrome is a disease process that we see in our patients. That's what happens when there's been improper removal and neovascularization or revascularization of dropped tissue from the ovary. Happens more commonly on the right than the left. Makes sense. Anatomically, removing that right ovary is often a little trickier because it's further north, further cranial, a little bit harder to exteriorize that tissue. The median time for noticing ovarian remnant syndrome is about 34 months post-spay, ranging anywhere from 1 to 120 months. What will you see? You'll see signs of recurrent estrus. You may see a stump pyometra or a regular pyometra if an ovarioectomy has been performed. You could also see other behavioral signs, and the diagnosis is on vaginal cytology or hormone assays. Other less common reasons why we might be going to surgery in a dog or a cat could be variations in sex hormones, sex chromosomes, their gonads, and their phenotypes. So pseudohermaphroditism is when the chromosomes and the gonads match, but the phenotype does not match. For example, an XX pet with ovaries but male external genitalia, or an XY pet with testes but female genitalia. One example of this syndrome is persistent Mullerian duct syndrome, particularly found in mini schnauzers. I've seen one of these. They are XY with a male phenotype, but they do still have some of the traditionally female organs internally. I've done pyometra surgery on an emergency basis on a mini schnauzer with persistent Mullerian duct syndrome. There can also be what's called true sex reversal, where the chromosomes don't match the gonads. That's less common, even in comparison to pseudohermaphroditism. Again, these things are very rare, but certainly worth knowing about. Next up is pyometra. So the most common uterine cause of needing to go to surgery for the ovaries and uterus, and probably one of the most common reasons for an emergency surgery, full stop. So what is the signalment? It's dogs, mostly late middle age, greater than or around 8 years old, and cats older than 5 years of age. Again, as I mentioned earlier, it's very, very high risk of incidence of this disease process in an unspayed dog, about 23 to 24%. The incidence is unknown in cats because cats like to keep their mysteries to themselves. This occurs mostly in diestrus or metestrus, or in cats with the corpus luteum. Sometimes the timing isn't always clear, but usually the story you'll get from an owner is that they had their bleeding a few weeks ago. Why does this happen? We think the etiology is multifactorial. It used to be believed that this was a purely progesterone-dependent disease process. Progesterone causes cystic endometrial hyperplasia, and then secondary infections develop. There's new research to suggest that the Pyometra may not be as dependent on this process as we expected, but certainly very important to know that that is a likely etiology. Then what happens? When we have this patient in diestrus, there is an ascending infection with E. coli. We think it's most likely ascending, could be hematogenous or lymphogenic, but more likely urinary tract infection or contamination around the vulva that allows for an ascending infection into the uterus. How do we diagnose a Pyometra? A lot of the time it's very, very obvious. This is a patient with the appropriate history and an intact status and vulvar discharge. That's an open Pyometra. Unfortunately, closed Pyometras can sometimes be quite difficult to diagnose. They might present with polyuria, polydipsia, vomiting, inappetence. They might just be in pain. They might have an elevated temperature, an elevated heart rate, or breathing pattern. It may be relatively vague. Clinical pathological findings include a neutrophilia or a neutropenia, bands or a left shift, anemia, elevated liver enzymes, low albumin, high globulins, or even azotemia or hypobilirubinemia. Septicemia, peritonitis, and SIRS can all happen with Pyometras, whether they have ruptured or not, because translocation of bacteria can still cause septicemia even without rupture of the infection in the abdomen. How is it diagnosed? Certainly radiographs, multiple fluid-filled organs, also on ultrasound, too many bladders is the way I was taught to diagnose a Pyometra. Those are the most common methods of diagnosis. Also, we need to talk to owners once we've diagnosed the Pyometra about outcome. Pyometra surgery is a spay. It's a complex spay, and there can certainly be risks associated with spay given how sick these pets sometimes can be. But the mortality rate is quite low. It's considered less than 5% in dogs and around 8% in cats. Unfortunately, the mortality rate does jump above 50% with a uterine rupture, but again, prognosis and outcome with Pyometra surgery is very, very good. There can be some pretenders for Pyometra, like mucometra or hydrometra. Again, usually we just go based on history, clinical signs, and clinicopathologic markers such as white blood cell count and the illness of the patient to determine between the two of those. The worst case scenario, you remove a fluid-filled or a mucoid-filled or mucus-filled uterus. It's not the end of the day, you've still spayed the pet, but definitely keep in mind that there can be some disease processes that can mimic a Pyometra. Another type of uterine infection, which obviously very similar to a Pyometra but has a different etiology, would be metritis. Usually this occurs postpartum with dystocias, if there's been obstetric manipulation, or if there's a retained fetus or placenta. In these dogs and cats, there will be the history of birth, of parturition. There will often be a malodorous discharge, as well as systemic signs of illness and changes to the CBC. Treatment, of course, antibiotics, just like with the Pyometra, and immediate surgery as soon as possible. Other less common disorders of the uterus that will necessitate surgery include a uterine torsion, uterine prolapse, or uterine rupture. Again, not common, usually associated with parturition. Uterine prolapse, sometimes it can be treated by manual reduction, but very frequently surgery is recommended. Now, dystocia is something that we see, unfortunately, relatively frequently, particularly with the increased popularity of brachycephalic dogs who have a lot of fetal maternal disproportion with their big heads and trouble coming out of the birth canal. It's less common in cats, but can be seen in purebred cats as well. And we do see an increased incidence in Scotties, Chihuahuas, Pomeranians, Wolfhounds, and Great Danes. What is the pathophysiology of a dystocia? Maternal causes are most common, including uterine inertia, secondary inertia or obstruction, and then abnormalities of the pelvic canal. Fetal causes of dystocia can include malposition, malformation, increased size of a fetus, and of course, unfortunately, fetal death. Diagnosis of dystocia in dogs is a little bit simpler than diagnosis of dystocia in cats. In dogs, there's lack of progression from stage 1 to stage 2 of labor in 12 to 24 hours, failure to liver pups within 36 hours of their temperature dropping below 100 degrees Fahrenheit, of course, any signs of toxemia, of sickness or illness of the mother, greater than 4 hours between pups, and active contractions lasting greater than 30 minutes without any puppy being produced. Also, looking at radiographs, look at the number of puppies, of fetuses, their position, and also see if there's any markers that they may not be alive. So ultrasound, looking at viability via heartbeat. Also, there are transcutaneous whelping monitors that can be very helpful for detecting abnormalities in fetal heart rates. In cats, because there can be a delay of many hours between kittens, it can be more difficult to diagnose dystocia. We tend to go more upon how the mother looks, if she is in any sort of distress, if there are signs of toxemia, as well as with ultrasound or a monitor determining fetal heartbeat decreased rate. That's one of the biggest one, or of course fetal death. Even though I'm a surgeon, I always want to try non-surgical or medical management first. So with dystocia, as long as there's no obstruction of the birth canal, no obvious malformation or malpositioning of the fetus, or of course any abnormalities in the pelvic canal of the mother, we can try these medical management. Also with fetal distress, going straight to a cesarean section is indicated. What is medical management? Oxytocin can be given. You can give 2 doses of oxytocin 30 minutes apart. If that's not effective, then it's not likely to be effective in addition to that. There's unlikely to be any advantage of calcium or dextrose, but certainly if the dam is hypocalcemic or hypoglycemic, supplementing those are very important. Also manipulation. There have been several times in my experience where there has been a puppy or a kitten caught in the birth canal that can be gently and sterilely removed from the birth canal, allowing the other pups and kittens to come out. There is about a 30-40% success of medical management, but approximately 60% of dogs and cats presenting with dystocia will require surgery. So you've determined that a dystocia is surgical. Medical management has not been effective and you need to go to a C-section. What can you talk to the owners about? The outcomes, very, very good for the dam, for the mom, about 99% rate of survival there. However, not necessarily quite so good of an outcome for the pups. About 87% of pups will survive within the 2 hours. However, usually about 8% of puppies are stillborn. Very, very dependent on the presentation. Is this a dog that's been monitored very closely and the dystocia was noticed as soon as it was occurring? Or is this a dog or a cat who might have been laboring for a long time? Certainly, we want to talk to owners about bleeding, risk of organ lacerations or uterine rupture, septic peritonitis, hypotension, and certainly if these are breeding animals where we're not spaying the dog or the cat. And again, most of the time, we are recommending an ovariohysterectomy in cases of dystocia. But again, if this is a planned C-section that went awry, or a dog or a cat that's a breeding animal, we do have to talk about risk of rupture and risk of complications in future births. So when we think about a C-section, we think about people. And in a person, that involves opening up the uterus, removing the baby, suturing everything back up, cleaning everything up, and making sure that everything is where it remains. Now, in dogs and cats, when we refer to a C-section, that's similar. It's a hysterotomy, so an incision into the body of the uterus, remembering that there are the horns of the uterus and the puppies or the kittens sit in the horns, but we only want to make one hysterotomy incision, and that's all that's necessary. So a C-section, traditionally, if we want to leave the uterus in place, would be packing everything off, making a single hysterotomy incision into the body of the uterus, milking the puppies or the kittens down to that incision, and then flushing, cleaning, and suturing closed the hysterotomy incision. That can be 1-layer continuous or 2-layer interrupted and inverting to certainly make sure that you've closed everything without decreasing the luminal diameter too much. Another reason to perform a traditional C-section, even if you're planning on spaying the dog or the cat, is time. For the other option, which is an en bloc OHE, ovariohysterectomy, you have to be fast. There is no increased risk in neonate mortality with an unblocked OHE if you're fast enough, and there is a significantly decreased risk of contamination of the abdomen and a much shorter surgical time. That said, we're talking about time because of blood supply. If you're concerned that your on-block spay will take too long, and there may be a period of time where there is no blood supply to the uterus, therefore no blood supply and no oxygen to the fetuses, then you'll want to perform a traditional C-section and then complete your ovariohysterectomy once the puppies or kittens are safely removed. Some tips and tricks that I've learned over the years about neonatal resuscitation. We certainly used to learn that we should give them doxapram if they weren't breathing well. That's a respiratory stimulant. It's no longer indicated in neonates. It doesn't help outcomes, and it can increase oxygen demand on the other tissues like the heart. We can give naloxone that can be given sublingually or through the umbilicus. You can give epinephrine umbilically as well. One thing to note is that bradycardia in neonates indicates hypoxia. So just increasing their heart rate isn't fixing the problem. We need to make sure that they're breathing better and they have oxygen. So these little neonates can be absolutely adorable, but one thing we have to think about, instead of just thinking of how cute they are, is trying to see if we can keep their umbilicus a little bit longer, because that's a very, very useful place to give injections. So when you give the puppies out to the nurses, to your puppy catchers, let them know that when they're clamping the umbilicus, to make sure they leave it long enough that you could give an injection if you had to. Certainly, uterine neoplasia, just like ovarian neoplasia, can happen in our dog and cat populations. Probably not the most common reason why you'll be doing surgery on the ovaries or the uterus, but absolutely can be an issue. So same thing, ovariohysterectomy, nothing complex or different about that type of procedure. One procedure on the uterus, which is a spay but can be a little bit more complex, and I can give you some tips and tricks there, is uterine prolapse. So this will be a dog or a cat who recently gave birth, and the owners are seeing a portion of the uterus prolapsing outside of the vulva. Sometimes in these dogs and cats, all we need to do is just do an abdominal incision and spay them, because we can pull the uterus back up into the body with that spay. What I prefer to do is to see if gently I'm able to reduce part of that prolapse prior to going to surgery. If I can't, it can be very, very helpful to have an assistant, a sterile assistant, or you can drape in the vulva as well so that you can access the prolapsed portion of tissue as well as the abdomen at the same time. Rarely, sometimes it is necessary to resect some of the dead tissue external to the pet prior to pulling the prolapse back in, but then you you have to do the spay. These can be very scary presentations, but usually the surgery that's required is just a spay, and you can fix these dogs and cats up quite quickly, and you can feel pretty good about your decision making. That concludes our module on surgery of the ovaries and uterus. Next up, urinary surgery.